Hello, everyone. This is Dr. Sunil Tumala. I'm one of the practicing neurologists in Frisco area. I'm here today with Dr. Mandip Acharya to discuss about the COVID-19 and how he can help the residents of the Frisco and DFW area and what is actually going on as of today. Time is 7 p.m. and today is Wednesday, May 6, 2020. Dr. Acharya is a board certified internal medicine physician. He's from Nepal and he's practicing here in the area for almost the past 8 years. And besides being an internist, he's also a hospitalist at various hospitals locally. He's also the founder and president of multi-specialty practice, Access Primary Care Specialist. He has privileges at Baylor Hospital and Texas Health Hospital, besides Medical City Plano and Medical City Frisco. His special interest is in allergy, asthma, diabetes, high blood pressure, and cholesterol. And he speaks English, Hindi, and Nepali, to be specific. And he's available in Frisco as well as various other locations in the DFW area. With that, I will start this discussion about the COVID-19. Dr. Acharya, please describe what do you mean? What do we mean by COVID-19?
Thank you, Dr. Thumala. It's a pleasure and honor to discuss about the COVID-19 issue with the community and try to do some education awareness. Certainly, COVID-19 is basically a short form of saying a disease caused by a virus, which is a coronavirus. And this is a special type of virus that was found in Wuhan province in China, which started causing disease, especially pulmonary problems, which was complicated by severe acute respiratory syndrome, where patients were not able to breathe, having severe inflammatory pneumonias and respiratory failure complications. So this was identified, and to make it easier, we started calling it COVID-19 instead of calling a long name of SARS-CoV-2 type of virus. It's one of the type of respiratory virus, as we all know. The coronaviruses are just common viruses, and normally even before this, every year we used to have patients with respiratory symptoms. Common cold, runny nose, sore throat, cough, So those viruses used to cause those problems, and we used to treat every day in our office, in the hospitals. But this strain of virus has something with it, and it's creating more complications down in the lungs, due to which patients are clearly going into severe inflammatory response syndrome, causing significant damage to our organs, especially the lung parenchymal organs. So it is affecting our oxygenation, couldn't breathe, oxygen goes down, patients end up in ventilators, which has also increased significant mortality. A lot of people have died, as we all know, because of this virus. So this is very important for us to know and understand about this virus. Again, this is a fomite-based. This is like any other virus. It's all in our secretions. The main important part that we have known so far is the virus can be transmitted by people without having any symptoms. That's the most important thing, and that's why we came up with all this social distancing rule, which is so vital to break the spread of the virus. Going back to the microbiology, the virus is basically a small pathogen that needs a host to multiply. So, without a host, a virus cannot multiply, cannot transfer between people. So it needs a live cell. So that's why we humans serve as a host for the virus. Initially, when the initial the RNA analysis was done, it was thought that the virus has some properties of the viruses, of the coronaviruses that was floating in the bats and maybe even the pigs, and maybe there was some kind of mismatch between those RNAs and led to the production of this mutant version of the virus, which is what we call COVID-19. So basically, from that animal origin and bat origin, we ended up in humans, and somehow the virus got and acquired that characteristic that it can now multiply in human cells. And now it can be transferred between one human cell to other human cells. So when we are around, we may touch our face and nose and eyes and all our secretions, or we just blow our nose, cough. We don't see these particles. They're all so small, and then it might be floating in the air for a while, and we may not even know. And if we're asymptomatic, if we touch some things that has those particles, we carry it for a while. As long as it has certain time, they are still active, then it can be transferred between people to people. So social distancing does play a big role on that. We came up with this 6 feet rule, where if we are in those distance, 6 feet distance between people to people, the chance of spread is low. Again, hygiene is very important. As we know, the virus has a covering which is basically very soluble, lipid soluble particles. So the soap is considered to be very effective on those viruses. The hand sanitizer, alcohol rich medium is also okay. But I think as a physician, soap and water, hand washing is the best. And I think if somebody has to work on a daily basis, go out, especially us physicians, we try more of hand washing, try to get rid of the virus completely, because soap is significant uh, disinfectant and basically gets rid of the virus from our surfaces.
And who is more likely to get this viral infection? Is it everyone, or some people are more susceptible than others?
Dr. Thuma, thank you for the question. That's a very good question. Statistically, we have seen that there are certain patient population, patient groups who already have underlying health problems, especially chronic illnesses, patients with diabetes, patients with high blood pressure, patients with high body mass index. So that these are the group of people who had more complications and more symptoms with the virus. Again, with age, we have seen that the incidences of the viral infections go high once we get more older. In children, there can be viral illnesses, but a complicating illness or severe illnesses are less. It's not that it's zero, they can still get infections. And unfortunately, I have heard some news, some children did get some major complications. But on the statistics analysis, there's more patients who are more elderly, they are more at higher risk. So elderly is significantly at high risk. We have been recommending elderly to really uh, be on a social distancing measures more, particularly because if they get the infection, the complication rates are so high that there's high chance of getting into respiratory failure, ARDS, pulmonary edema, pneumonias, even there's a lot of mortality on that. Same thing goes with patients with diabetes. Same thing goes with patients who has congestive heart failure, or COPD, chronic lung condition, patients with asthma. This is allergy pollen season. A lot of patients with asthma get a flare up at this time. If there's a coexisting viral illness like COVID, then that would certainly take a big toll at this time. So we have been recommending patients with allergies and asthma so that we don't get any confounding situation. What is the symptoms coming from? Is it from the asthma, COPD, or is it related to the COVID causing your cough, shortness of breath? We've been trying to really educate patients to stay on inhalers, talk to your doctor, make sure you're really compliant, and get your at least asthma component under control, and avoid smoking. Don't get your COPD component flare up at this time, because if you end up getting a virus on the top of that, it can cause significant toll and significant health complications. Dr. Thumala, please.
Dr. Acharya, what are if you give a brief summary of maybe three symptoms that we have to watch for to raise a concern that someone may have COVID-19?
Thank you very much, Dr. Thumala. That's a very good question. I think as a just general population, general person who really want to worry about, like, what are the three major symptoms? So first, number one, I will call it a fever, because it's one of the hallmark of any viral infection from most of the and any viruses. So normally when the viruses gets in our body, it just circulates the whole body. It's called viremia, and the major manifestation of that is our body temperature goes up. It's just our body's response. It's actually body's trying to get our body temperature higher, so we try to control the viral replication. So fever is, I think, the number one symptom that kind of helps us, as a general practitioner, kind of go around what are the chances of having this virus versus like a common cold, like runny nose, or just kind of pollen allergy. So what are we dealing with? Fever is the number one. If you have a fever, especially like 100.4 or higher, that's really significant. Even now, sometimes patients with chronic illnesses who cannot mount fevers, chronic immunodeficiency conditions, even a fever of like 99 temperature, we might have to be a little more concerned if that's the case, and especially if we are dealing with any respiratory or pulmonary cough, shortness of breath, other symptoms. So number one is fever. Number two, I would call it shortness of breath. Number two is shortness of breath. If you feel that you just have hard time breathing, then along with the fever and shortness of breath, that raises concern that something is going on. And number three is definitely cough. Cough is usually dry cough. Usually you can't produce anything. Nothing comes out. You just have that irritation and dryness and just constant coughing spells. That's kind of hallmark of this illness at this time, Dr. Tumala.
So it's a fever, shortness of breath, and a dry cough. So looks
Right.
three major symptoms one has to look for. And I think you touched on who is at risk of complications: diabetics, asthma patients, and obviously anyone probably is who is immunosuppressed, right? So,
Yes.
and what can they do when they have symptoms? So like should they stay at home or should they contact someone to get tested? And how does it work?
Well, that's a good question. Thank you, Dr. Tumala, for clarifying that. So if somebody, anybody with chronic health conditions, or anybody who are concerned about, if they have any of these symptoms that we just discussed, if anybody has dry cough, or if they feel like they just cannot get enough breath, the chest is tight, they're getting short of breath, uh, and also they feel that the body temperature is high, they're running some fevers. So these are all concerning symptoms. So if you have your doctor, definitely need to reach out to your doctor, especially if you're having chronic health conditions. So first of all, as we will just discuss this here, and I just mentioned, uh, we have to understand that you could be transmitting this to other people too. So you're living with your wife, husband, your kids. First thing is, if you have concern, you should start what we call trying to isolate yourself. What if you have a virus? But before you even get diagnosed, you might be already giving it to other people. So if you start noticing that, try to limit the exposure of yourself with other members of the family. Um, and then try to reach out with your doctor and discuss about your symptoms, and certainly the doctor will be able to guide you how to get that tested. Right now with the situation, several practices are offering drive-through testing, and several practices are basically recommending patients to basically get the screening through the online computer system. That's what we are doing right now. Patients contact us in the office on the phone, and we go on a telemedicine visit like this, video encounters, talk to the patient, screening questions, and then if we feel like definitely there is a risk of COVID-19, we generate an order, and then we basically guide the patient what are the next steps, how to get tested, and how to stay at home, what are the procedures that need to be followed, how to go with social distancing, how to isolate yourself. Definitely, wearing mask has been really important at this time, as you can limit the spread of the particle. I would definitely recommend, if you start having any symptoms, if you are isolating in one room in your home, if you have to go out, even in the common area, definitely wear mask if you have, and definitely when you go out, make sure you wash your hands with soap and water. Try to limit exposure to other people in your home, and reach out to the physician and discuss the care. If they need to order the COVID test, definitely do that. Or if you have more symptoms, maybe they need to do a chest X-ray, or they might recommend you to go to the ER, get checked out, because early treatment might improve more than later treatment. That's what we've been seeing now. That if we act on early than later, that might may be able to change some outcomes. We haven't gone into the treatment aspect yet, but I think at this time, seeking help is very important. Dr. Tumala.
So, looks like there are a lot of confusion regarding the testing. Some patients are asking for tests, and some patients are scared about this testing. Looking at the videos, they are putting like a nasal swab, very painful. So, some people are confused, like, should we go for testing if it is too painful? And I think there is some antibody testing as well. Like, what are the limitations? and what type of tests one should get if they have symptoms versus if they don't have symptoms, but they are curious to know whether they acquired infection and recovered, or they never got the infection so far.
Well, that's a very good question. Actually, it's a basically burning topic right now, because so much of pandemic is going on, and we just don't know how many people actually already had infection and got well, and how to test all of these patients, and how to do that even in our practice. So if patient have an active symptoms, what we call at that time is you have a virus basically circulating in your body. So what we want to check at that time as physicians is we want to know if you have a particle of that virus in your secretion. So that's what we need to know. So to test that, we need to do what you call a diagnostic test to make a diagnosis. So, and then that way we can isolate you, because now you have a circulating virus in your secretions, in your saliva, in your respiratory samples. So to do that test, what we do is what you call a swab test. So swab test basically is we do that very commonly in offices, and many patients might have had done for flu test in the past, and even we do it now. So it's a very delicate filament. It's not painful at all. It's just a little bit of uncomfortable, maybe for like 2-3 seconds, and then once it's out of the nose, then you're fine. So it's just a little bit of that uncomfortableness. That's what is mentioned. But there is nothing about pain issue. There is nothing about pain. No need to worry about the pain. I think it's just you have to be prepared. There might be a little bit of sneezing reflex that might come out, or something like that. I don't think there is any pain associated with that. Um, but it's important that it has to be done with the right technique. That's important. That's why there is this home swab test that came out. So again, that has a limitation from the technique, because some patients may not have enough virus circulating on all secretions, even outside. They may have more virus load inside the back of your nose. That's called nasopharynx, which is basically once you reach, let's say we put a filament all the way from the nose, reach all the way inside, and it's not going up, it's going the back of it, from the floor of your base of your nose. Even though we look like nose is going up, our actually cavity goes backwards. So we go on the base of the cavity in the back of the nose, and we get samples from there. So that's where we catch more of this virus load there. So basically, it's not painful. It's just a little bit uncomfortable. I definitely recommend people to get that done if you are concerned and have some symptoms. So that's one. And then we want to catch that virus particle by doing what you call a test is a PCR, polymerase chain reaction. It's basically detection of RNA. It's one of the main virus particle that basically we can specifically identify certain nucleotide sequence which is specific for that virus, so we can confirm it's actually the COVID virus and not any other virus. So that's the gold standard test, what's called PCR. That way we can identify. It's so important to identify active sick people, so we can isolate the people, so we don't get more people infected. So that's the gold standard. So going beside that, and Dr. Thumala, you just mentioned about the antibody test. So that's another thing. So antibody tests are mostly for screening the community. I would not recommend antibody test for the diagnostic test purpose, in the sense the reliability is still not clear at this time. Studies are still not completed. We don't have any validated tests yet. The FDA has emergency approved for this test for time being, but we don't have enough data. Still, the data is still to be out. So those tests basically can tell us that whether you may have had those infections, 2 months before or recently. We don't know. Again, antibodies are of two types. One is called IgG antibodies and IgM antibody. So theoretically, based upon our knowledge of microbiology, when we get any infections from any kind of pathogen, viruses, we immediately respond with what you call an IgM antibody. So let's say we did an antibody test and we found that IgM was positive. So by theory, we could consider that, okay, maybe you have had an infection recently. So we don't know what is that recently means. maybe you had an infection about a few weeks ago, a few months ago. But based upon our immunology knowledge, it takes our body at least about maybe like 7 days, maybe 14 days, 7 to 14 days to mount that even immediate antibody response of IgM. So if you have some illness and you just recovered and you got better, you went back to work and somebody went to doctor's office and they checked your antibody and positive for IgM. It's possible that you may have had COVID recently, but if that person is not symptomatic, there is no symptoms, no runny nose, no cough, no shortness of breath, no fever, then if you do a swab test, it can be negative because you don't have any symptoms. Basically, your body cleared the virus from your body. Your body already, the immune system fight against the virus is clear, but there is basically antibody response that can be detected, which is IgM antibody. And then later on, let's say you have had some kind of respiratory illness about 1 or 2 months ago, then by about 21 days or so, your body starts making another antibody called IgG antibody. Sorry. IgG antibody is what you call a little bit long-term antibody. And by theory, if you have IgG antibody, you could potentially be immune to it. We don't know whether you will be immune or not because we don't have any data. We don't know that patients with IgG antibody may not get another virus in the future. We don't know that. But we're hoping that, if we know that if they have IgG, maybe we can do some trials. Maybe trials are going on, research trials, that patients or people with positive IgG titers with a high level of those antibodies hopefully are immune and may not get the virus. But again, the viruses can change their characteristics, and we don't know if it's influenza type or not. Influenza, even if you get one influenza this year, you could always get another little bit of different type of influenza virus next year because there is so much of change in the virus characteristics. They do so much of mutations so often, so you could always get. But the good thing is, by theory of immunology and microbiology, if you get some type of immunity against that kind of virus, if there is a little change, your body will still try to fight and control it. So the severity of the infection may not be as high as you're like a naive and you don't have any immune system like we're dealing right now with COVID-19. Seems like this virus is completely brand new characteristics and we don't have any immune system in our body, has no knowledge of this virus, how to fight, and it's just creating a cascades of things that is creating significant complications. So basically the testing wise, just to summarize, PCR-based swab testing when you are actively sick to find the virus and isolate, and for screening and community surveillance purposes, whether who had the virus, how many people could have already been infected, those kind of information can be gained by testing for the antibodies. But the things that we don't know yet is, even if you have antibody positive, anybody should not feel that now I am good, I may not get COVID. There is no guarantee because we don't know yet. So it's not like, some other antibody tests, like, we think about other diseases, like, you've got varicella antibodies, measles antibodies, so you've got good antibodies, so you're protected. So we don't know yet whether these antibody levels will be protected or not. It could be, but we don't know yet. We don't have data.
I think,
Thank you.
I think one of the senator, he's, I think, Senator Rand Paul, he got infected and he claims that, he cannot transmit and he's immune because he already got COVID-19 a few weeks ago. So he's not wearing mask and he's telling, no need to wear mask. So what I'm sensing is it's probably incorrect, right? And obviously, even if you have infection in the past, it is still possible that you may get reinfected, and so potentially you should, apply all the precautions like any other person.
Yes, Dr. Thumala, I think since we do not have evidence that positive antibody is protective, I think we should not take chances because we don't know.
That makes sense. Yeah.
It turns out that it's not protective immune response yet. So what it turns out that they could still get infected. We don't know.
Exactly.
So good luck that if they have immunity, if they have positive antibody, and if they're immune, well, that's a good thing if that's the case. But since we don't have data, until then, maybe until we have all those data out, I think it's always best to protect ourselves, protect your friends, family, and the whole community. If you have had something like that, protect yourself again. This virus or any other virus, I think it's good to protect yourself.
How good is the homemade mask compared to N95 or surgical mask? I think people are buying them on eBay or Amazon and creating scarcity for healthcare providers. So whether regular people buy just wearing a homemade mask is good enough, or should they go for any surgical mask or N95 mask?
So that's a very good question. Again, we're having this conversation because we know that there was a significant problem not having enough personal protective equipment for us physicians and healthcare providers, first responders. Since as we can all understand, what will be the viral load in the surrounding of a person who has an active infection and is coughing, sneezing, or in a healthcare environment who's being given some inhalers or breathing treatments, or let's say they're on a ventilator, they're constantly releasing these viruses around the air and circulating. So basically, what is the thing is, if somebody is sick at home, I think a homemade mask should be enough, because you could potentially isolate yourself and try to, as long as you cover your mouth, it will cover a lot of these things. Again, if you just look at the efficacy of these masks, which one is the best and will not get out any particles, then the N95 is the best for the people who don't have infection and who don't want to breathe that particle with viruses in them. Okay, so but at home, if your family has or anybody has those symptoms, as long as you isolate them and their virus, whatever they breathe, sneeze, cough, is in a separate room, and they are still wearing a regular cloth mask, it will decrease the amount of viral spread even in the air. A lot of particles will go in the mask, you dry it up, and the virus dies after some time. So just change your cloth mask time to time, and it should be just pretty much a easy way to control the spread. But for a healthcare provider in a healthcare practice setting, let's say you have to go to the intensive care unit or in the ER or do some procedures, definitely there is a lot of these particles in the air that you're trying to intervene there, do something, and then you definitely want N95 mask there, because that's the best in terms of not getting any viral particles coming from the air into your air that you breathe. So I think for the community level, I do recommend just doing cloth mask for now. I don't I don't think going into surgical mask will add much value from cloth mask. Um, Cloth mask should be significantly sufficient at this time, because going and breathing regular air. I think if somebody is sick, and if you are staying at 6 feet distance, that's I think is the key, because if you are going to breathe a virus particle, the virus actually floats around that person for a certain while. If somebody sneezes and cough and you are trying to talk to them, if you are at least 6 feet out there, then when they do that, if you are wearing a cloth mask, if they are wearing a cloth mask, the amount of particles spreading out is much less than either or anybody's not wearing it. So I think if you wear a cloth mask and have 6 feet distance, I think that will solve a lot of that problem, and that purpose is met with the cloth mask. And I think we should let healthcare workers who have to deal in the front line with known patients where that there is a lot of virus floating around, they should be using a 95 mask. And even in the surrounding places where, like a hospital, where there's a high chance that somebody just coughed, or sneezes and walked out of the area, and maybe the air still has a floating particle there. You just don't know. You just turn around the corner and somebody just sneezed there. You don't know that. So for those situations, you might be wearing either a cloth mask, even as a healthcare provider, or a surgical mask, just to kind of walk around and go around the spaces, the hospital area, where there's a high chance that somebody, like sick people or people who has possible infections, viral infections, are kind of going around. any places where there's so much crowd, which, the crowd, we already told when the governor reopened the economy that we had to reduce the amount of people who are in any kind of gathering now, because that way we can cut down the people in one covered area at one time. So there is less risk that people are just kind of being close to each other. I think that these are the things that we can do. And going back to the mask, this is what I personally recommend. I think is the best strategy at this time.
So the best way to prevent is to wear some cloth mask when you're outside and maintain the social distance, obviously
Yes.
reduce the risk, right? So
Yes.
to should be good enough for most of the.
It should be good enough if there are two people talking to each other, the 6 feet distance, both wearing cloth masks, that should be good enough. And then hand washing should be, I think there is no substitute for that. I think that's the key, because if you forget, and then if you touch several places, and then even if you try to remove the mask, if you're not good enough, and removing and try to pull from the nose or the mouth, it's not a good idea. Try to put the hands in the back. Wash your hands first, open water 20 seconds, and then make sure every places have been washed out. And then take the mask from the back, and then take it out that way. So you're not putting anything in your mouth or nose or anything like that. Because the mask outer surface, technically, if you have been outside, let's say you went to a place where there's a lot of gatherings, and you talk to someone who you thought may or may not have anything, but the outer surface could have some particles because you can't see those things.
It's contaminated, yeah.
Yeah, so you don't want to touch the outer surface of the mask.
So essentially, wash the hands and then remove the mask and then wash your mask.
Wash the mask. Yes.
Disposable, right?
Yes.
Is test covered by the insurance?
Yes. So that's a good question. So far, most, and I think all of the insurance companies have decided to cover the COVID-19's test. So patients should not be getting any share of patient responsibility on that. Actually, I think the state government and I think federal government are also promoting that those diagnostic tests for these. I think even the antibody test. I was told by one of the laboratory representative that if you order these tests, then they might cover these tests. Definitely, I think the PCR test is definitely covered. Um, Definitely covered by the state government. So basically, there is no cost for the patient to get these tests done. It's just so that we were encouraging patients to get tested. It is covered most of the time by the insurances, and the government is covering it as well. I haven't had any problems from any patients in terms of.
So, so as long as they have symptoms, the test will be covered.
You're right. So
Somebody who
symptoms
wants
are
to,
the key. So symptoms with physician's order.
yeah. What about those patients, who just are curious to know? I think, we are getting too many calls, right? I want to get it tested just to see if I have infection. So I think that.
Right. So there can be some areas where that can happen. So I think talk to your physician. I think there are certain indications of testing. So let's say you think that you may have been exposed. So there are certain insurances who are covering certain tests based upon what diagnosis codes are used. They have given some guidelines on the certain diagnosis codes. So if those diagnosis codes are used, let's say an exposure to a virus, um, and you don't have any symptoms, just the fact that you've been exposed, but you have a chronic health condition. Let's say you have bad asthma, COPD, diabetes, and a physician thinks there's a medical necessity to know the patient does have been exposed or maybe have had some kind of pre-symptomatic or early things. So then it might be covered. Again, this can be case by case since you don't have an active symptoms. But if you have a symptom, then it's basically a symptomatic problem, and basically clinically there is a suspicion of a viral illness. So that these are definitely covered. Um, but as your question is, since you don't have symptoms, you're just trying to kind of find out. So there can be some it's not 100% guarantee that they will cover all those tests. But physicians can basically guide you how to get that test order with the proper appropriate diagnosis codes. So that may justify the medical necessity why you are ordering it, and not just screening the whole population.
Is there anything that people can do in terms of supplements or medications they can take to prevent it? Uh, if they suspect that they might get it, how can they prevent it besides mask and hand washing? Is there anything they can take?
Well, I think that's a good question. In general, your immune system is the key here, and I think if we can do all the things or anything that we can help our immune system to prevent any kind of illnesses, including viral illnesses. So, common things that I see is basically rest. So when patients or anybody is a lot of stress, a lot of work, and not resting, not sleeping, and illnesses come up, especially viral illnesses. The immune system goes down, as we know. That if you're sleep deprived, Dr. Thumala, you're expert on that. So your immune system definitely gets a toll if you're not sleeping, properly. So if you're not getting adequate sleep, your cerebral brain function, I guess, is not to the par, and it's not adequate. So definitely that has probably some signals to your body, maybe your bone marrow, your immune system. All there is some type of definitely neurological connection there, Dr. Tumala, right? And
Yes,
then
I think certainly brain and body are
so certainly that can affect. If you don't sleep enough, you not rest enough, you're at risk of viral illness. So I would recommend you get adequate sleep. That's number one, that you feel rested. You're not just stressing out and dragging yourself. Number two, try to do some type of physical activity. Try to get your body metabolism up to the mark, that you're basically trying to get your blood flow around, at least 30, 45, 50, 30 to 60 minutes of physical activity. Could be anything. You can take a walk in the neighborhood. You can put a mask. It's safe. Couple of, with your husband, your kid, anybody, you can take a walk up the community and take 30, 40 or 60-minute walk. Anything is better than zero. So I think taking some type of physical activity is helpful. If you can do, like even indoor activity. I know people are concerned going to the places like gym, even though the governor has plans to try to open that slowly. But even at home, also some type of activity is good. In addition, uh, this yoga, these yoga posters, they do help a lot of, there are a lot of breathing exercises in yoga, which I think personally that they help in terms of getting your physical metabolism corrected, plus some type of pulmonary exercises, so that might help. There are several, pranayama and all kind of, different types of yoga that definitely will have some value there, because these are very ancient, and it does impact our ability to cope up and get some oxygenation, breathe better, reduce stress. So that these are the things. And going back to your question about what you should eat and what you can do, like maybe there is a lot out in the social media that you need to eat, and maybe drink this, and get a lot of turmeric. So turmeric, historically is anti-inflammatory Ayurvedic compound. So, historically, it does help to reduce some degree of inflammation. And as long as you don't have a clear side effect, if you take it too much, I suspect you may have some gastritis or something like that. But I think in moderate amount, as long as you don't get side effects, if it is not causing harm, I'm okay if you want to try and do that. That's okay. Vitamin C, historically, we know that, it's an antioxidant, it prevents viral infections. So try to get things with vitamin C, like any kind of citrus fruits, which has vitamin C in it. In general, adequate balanced diet, not having too much carb, not too much sweet in general, is healthy for your body, and adequate protein intake. Just kind of balanced diet will help. Just in general, Ayurvedic compounds are also there, like in our, especially this turmeric, as I mentioned, ginger is also another one that has shown some impact on,
How
and also.
about vitamin D? I think there is a lot of talk about it.
Right. So there is a good question. Yeah, good point. So vitamin D. we have been learning about this vitamin D for more than a decade or more than that, and it does have been shown to have some anti-inflammatory property. We have seen significant association with vitamin D in patients with diabetes, and chronic illnesses, asthma, sleep apneas. So definitely it's a role there. Vitamin D again is the sunshine vitamin. Getting enough sunlight is the key, and vitamin supplement. If you know that you have vitamin D deficiency, please take vitamin D supplements to try to keep your vitamin D corrected. Because if you have a good level of vitamin D, it will basically keep your immune system under good balance. Because it has immunomodulatory effect, and it will help you, prevent any kind of viral infections. Yes.
So summarize, essentially, good sleep and good hygiene, good food, some daily walking, and maybe some supplements may help to keep the immune system under control, right? So that's what.
Yes. 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 Dr.
Anything else in terms of the treatment that we found so far to be really helpful? I know the hydroxychloroquine, erythromycin, and this antiviral drug. There's a lot of talk, but looks like nothing really is basically known to be considered as the antiviral for this coronavirus. It's all like, yeah, it may help, right? There is no the antiviral that is antagonizing this virus.
Right, Dr. Thamala, as we all know, with all this knowledge in biochemistry and microbiology and pharmacology, so viral infections are basically the one that is being really, we have not been much successful on controlling this viral infection, especially even the influenza virus. We know that it reduces the impact a little bit, and your recovery may be a little bit early and hopefully prevent complications. Still, there's a lot of mortality even with influenza viruses. So viral infection control is very difficult. So again, I think since I was looking at a lot of research studies as we came along with this COVID-19, it all started with azithromycin in combination with hydroxychloroquine, thinking it might have something to do with anti-inflammatory property. Maybe the inflammation is the main reason people are having complication, which makes sense. So it was trying to reduce the inflammation, and if inflammation is reduced, then hopefully there is not major damage to the organs. So that's one key part. The other research has found that the virus does make some changes in the structure of the red blood cells, and so chloroquine type of compound, which has been used for malaria treatment, where the malaria pathogen affects the red blood cells. So that kind of analogy was used, and hydroxychloroquine was also introduced for that aspect. But in clinical trials, there is not significant benefit found so far, and in anecdotal, there's no evidence that it has worked. Again, personally, I have not treated many patients, but I initially tried on some patients. I had to stop due to side effects. Patients started having significant side effects, and they didn't tolerate it. But fortunately, it was taking like a week for the report of the COVID test to come back. So the test also came back negative. So fortunately, it was okay that I had to stop the medicine in like 3 days because of the side effect of hydroxychloroquine. Azithromycin is being used to just try to reduce the inflammation, and hopefully if there's any secondary pathogen or secondary atypical organism, any kind of other bacteria that's kind of complicating the situation, that might help. It has been used in general for like upper respiratory non-specific illnesses, non-specific bronchitis. So that's the kind of thought process azithromycin has been used, and it is still being used, just in case if it is COVID or not COVID. But as such, just for the treatment of COVID virus bronchitis, which is well proven, it has no significant improvement in the so-far clinical trials, just from azithromycin. They have tried remdesivir, which came out recently, data that there is like about 30% less recovery time. So people who took the remdesivir improved 30% less time for recovery. So again, I think the trial is still going on. Again, we still need to know that what are those numbers that we're looking at, what do we mean by the recovery, what was the point of recovery defined, and whether how many people eventually was it affecting, how many people survived. So a lot of these questions are unanswered. So again, there is some positive promise. So just to kind of feel that at least we're trying something, and definitely we have to be positive in this crisis situation. In addition, I have also heard in New York, several hospitals have tried monoclonal antibody therapy that was normally used for other autoimmune conditions. They have tried this because seeing a lot of inflammatory flare-ups. They tried an I think, interleukin 6 antibody, and they anecdotally they saw that, oh, maybe these patients was got out of the ventilator. So that kind of anecdotal, when I was having conversation with some physicians in New York, so they mentioned that, oh, we give a lot of these monoclonal antibodies, and it was easy to get them off ventilators. So again, these are anecdotal. We don't know if it actually worked. We don't have any kind of clinical trial data that, but they have been doing all kind of things like that. We didn't mention that a lot of COVID patients' mortality was also linked to the fact that it creates a syndrome of basically hyper-macrophage activation syndrome, where there's a lot of whole immune system hyperactivated, and it's also affecting the coagulation cascade. So what was happening is it was creating a problem, probably analogy like a DIC, where there's no bleeding issue, but there's a lot of multiple thrombotic problems. So major problem was like DVTs, and many people on autopsy had pulmonary embolism. So now, as a recent guideline, patients who are really sick enough, we're not talking about like in an outpatient setting for mild issues, but if they had a significant problem with hypoxia and pneumonia, and those kind of things, then one of the things that has been also recommended is to try some type of anticoagulant therapy. Again, we still don't know the data. I'm just talking about some anecdotal experience and recommendations from the community, which I've been following, the physician groups. So anticoagulant is, trying at least helping patients not to get complications, which makes sense. In general, also, if somebody has a pneumonia, there is a high chance of pro-inflammatory markers, increasing the risk of having a DVT or any kind of thrombotic events, and pulmonary embolism, blood clot that can cause complications and death. So these make sense. I think it is reasonable given so many high incidence of those complications creating problems. So putting them on some type of anticoagulant therapy to prevent these complications. Dr. Kamala.
Excellent, excellent. So I think that's a very useful information for most of the people, because I think they are more interested in how to prevent, how to identify, and whom to contact, and how to reduce their chance of spreading it. I think that's very useful information. From a treatment perspective, I think obviously they have to contact the physician and get individual advice once they have symptoms. This is made for educational purpose and not intended for any medical opinion for any single individual per se. Uh, Dr. Acharya, I think it's very useful information, and thanks a lot for this conversation with us. And
You're very welcome.
any final touches there? Any final points you want to say?
Well, I think this is a major, unprecedented time. Nobody knew, nobody thought that we will go through all this. I think this is our lifetime, probably knowledge, experience, and we are like learning and gathering knowledge on a day-by-day basis. So we as physicians are also learning. I wanted everybody to understand. I think the whole country, whole world is learning this virus, and we are learning along with you all. Our duty is to basically use our background knowledge that we gained from our medical school so far, all this experience, and try to gather those information and assimilate and try to use that in our practice to keep our patients away from this as much as possible, as we just discussed. And then even if we have symptoms, try to use our best practice advices, follow the guidelines, the evidence, the CDC, and all the relevant guidelines. We guide you in the right track to get you out of this as soon as possible if you have any type of problems like that. But I think staying away and not getting is also the key. As we didn't discuss earlier, the flattening the curve thing that we mentioned, overburdening the healthcare system was one of the major reasons of major mortality, because if we're out of beds in the ICU, then it's going to be disaster. But I think we have been so far successful, and so far the cases has been like flatly controlled. So as the cases come on, we have enough resources. We want to be in a position that we have enough resources to handle those cases. So I think that the final point is, I think, as anything we discussed, I think uh, to prevent infections for the whole community, not only you, me, the whole community, we have to think that way, is basically social distancing. That's the key, because you don't want to get that 6 feet distance. That's one thing. And then the second thing is, I think it's very important to just wear that cloth mask. You don't need any kind of surgical hi-fi mask. That cloth mask is just good enough, as you can just simply understand in just layman term. If you cannot get all these particles out and everything is captured by the mask, so you are limiting so much of this particle in the air anyway. I think the burden of the viral load in the air goes down significantly. And finally, not the least, is hand washing, which is, I think, I really want to emphasize that, because that's something that can clearly eliminate these viral particles from your hands, and that will keep you safe. And stay safe, everyone, and stay healthy. Again, we are here. I practice in Frisco, and right now we're doing telemedicine basically all over Texas. So, I have had patients calling me from actually all over Texas. So I've been fortunately busy in this time, and I'm fortunate that I'm able to participate and help all my patients, identify and be basically on your line and along with you in this crisis, and help as much as we can.
Dr. Acharya, can you give us your phone number and your website so that everyone knows it?
Well, my name is Dr. Mandeep Acharya, and my phone number is 972 643 8727, and website is txprimary.com. My practice is Texas Primary Care Specialist, and I practice in medicine.
And to everyone, Dr. Acharya is well known to me as well. He's a very good doctor. He's located in Frisco, just besides my practice on Kaiser Way, near the main street in Frisco. And he has multiple practices elsewhere as well. If you have any questions, certainly make an appointment with Dr. Acharya. Thanks a lot.
Thank you, Dr. Tamala.
Thank you, Dr. Acharya.